So let's talk about how young of a dog we could inject, right? I think this really comes into play of what diagnosis are we dealing with and what other interventions do we have or not have available. So we really don't have a great answer, right? We don't inject a lot of young dogs in general, right? We're not usually injecting dogs that are 4 months old or 3 months old, right? Because if they have a joint disease at that age, what are we dealing with? It may be something else other than osteoarthritis. Maybe sepsis, it may be, also maybe it's infection, right? A sepsis, or it could be an autoimmune disease. And autoimmune diseases historically are best treated systemically, because it's any and all joints that could be affected. So it's not always practical to really just inject those joints. We need to do something else to reset the patient's entire immune system. But if we have a dog, elbow disease can be as early as 4 or 5 or 6 months of age. Maybe that dog at 6 months is really super painful. So it's had a proper workup. Can it get to surgery, right? We may need a surgical intervention here, right? Let's say it's got a big floating fragment inside its elbow, right? Okay, can the surgeons reattach that? Can they remove that? And while they're there, they've got a 100% view of that joint. They know how much cartilage destruction is already there, how much synovitis is already there, and they can grade that. And as that joint's healing, we may need to help modify that joint's healing. So we could inject a joint, and I've injected a lot of joints in dogs under 12 months of age. But probably better than 90+% of those that I've injected that are under 12 months of age have already had an arthroscopic surgical procedure. So we know exactly what to do. We know exactly what's wrong. They've done the best they can to deal with the macroscopic view of that joint, right? Reattach something, remove something that shouldn't be there. And now we're in cleanup and management mode. So I've injected those after we've gotten a proper and thorough workup. How young of a dog could we inject with something? They probably need to be at skeletal maturity, right? Or if they're really already failing interventions, we want to make sure that maybe surgery is not an option. Maybe it's not an option because there's not a surgery to help it, or maybe because that's not financially in that family's capabilities. So yeah, if I can do something safely to help that joint at that age, then I will. It's just I want to know that I've done the right thing and I've worked it up thoroughly.